Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to our show. We've just chatted now about fashion and being stylish, but as we know, dentistry and cosmetic dentistry has become a trend amongst both males and females. With us today, we have a multi-talented individual, Dr. Rohini Bisaal. Welcome, Dr. Bisaal, to our show. And dentistry, such an interesting topic. I mean, it's not just about dental oral hygiene, but dentistry has now leaped with being trendy, having the perfect smile. So could you tell us, before we actually get into dentistry, tell us a little about yourself. How would you describe yourself in 5 words, being such a multi-talented individual?
Well, thank you, Losh, for having me here today. It's absolutely amazing being here. Dentistry and the career as a whole is transforming into something that is, I think, giving a lot of people that confidence boost. And I think me as a person, I've developed into a spectrum where I'm able to identify and grow in such a way where I'm able to show different sides of myself, and dentistry being one of the most significant parts of myself. So coming back to your question and trying to answer, how do I describe myself in 5 words? Wow. Okay, so let's just think about this. I'm very optimistic, very driven. I think I also have this zest for life, which is very enthusiastic about life. I would also describe myself as a ball of energy and magic. I'm very much into the fantasy base of life, and I think it's also very grounded, which I've been instilled, the values have been instilled by my parents, which is very important.
I like the way you've just said very magical, and I guess that's what's made you the brand ambassador for UniWorld. It is just having that positive energy and having the magical side of you. So could you tell us a little bit more about being a brand ambassador? What does it take to be a brand ambassador?
A brand ambassador, if you break it down, it's your brand and being an ambassador for that brand. So you got to look at it in a very holistic perspective. Does the brand complement you as a person? How are you contributing being yourself and your authentic self to a brand itself? And when I actually looked at the concept of UniWorld and I read through the concept of UniWorld, it's something that is very significant, which I feel young individuals, especially females, have that opportunity of entering something where they grow as a person, not growing into a different spectrum, but having or growing what they have within them and sharing it with the world. Because I always believe that what you have within you, and if it's shared with the world, it creates a beautiful ripple effect. So I think that is what I have been very much involved in, and I've been able to portray the brand in such a manner where we're able to attract those ladies or individuals who actually lack that confidence or want to go out there and make a difference. So I think that's what a brand ambassador truly, and the essence of a brand ambassador is.
Okay. So Rohini, with studying, coming back to being a dentist, the magical individual, the person that's optimistic, why have you chosen to study dentistry?
It's actually a really funny story. So when I was younger and I was in school, I went to my orthodontist because I had quite the crooked and skewed teeth, as they would call it colloquially. So I went to my orthodontist and obviously I got my braces. I loved the entire process. I know it was painful, but in my mind it was always no pain, no gain. And actually seeing myself transform, seeing what that actual treatment brought to my self-confidence and my ability to smile again, it was incredible. And I fell in love with the procedures. I was always intrigued about how did this specific procedure work. And that's how I got into dentistry. I just researched more about it, and there we go.
Your personality seems very much of a giving individual. So would you say dentistry was some way of giving back, allowing that person to have the perfect smile, or allowing that individual to feel more confident about themselves?
Definitely. I think the most how could I say, the most touching experience that I felt during my studying journey was treating geriatric patients, and especially patients who had no dentition or they've lost their dentition in older age. And you actually take an impression see the entire procedure of making a full set of dentures for them and seeing them smile at the end.
Okay.
That for me was, that was it. Like,
Fulfilling.
I'm here. This is what I'm supposed to do.
With studying dentistry, it's taken you how many years?
It's taken me 5 years.
5 years.
Yes.
And that's 5 full years away from home because you haven't studied in Durban.
No.
What was it like for you?
It was eventful, it was life transforming as well, and I grew exceptionally as a person. I think it was also very challenging at certain points because you don't have your mom or dad to motivate you constantly, so you learn to do it on your own. And that itself builds up to your own inner independence, which I think is quite a big part of a woman's life, I think, in today's society and age, because when a woman is confident and when a woman is independent, I feel she can make magic happen in this world. So yes, it was a beautiful journey. Beautiful journey.
Is there anything you miss about Durban in those 5 years?
In winter, the warmth. I would say that definitely, but my family mostly.
Coming back to dentistry, which is your passion because you feel that you make a difference to individuals, not many of our viewers know how important it is to visit your dentist. We tend to shy away from the dental visit. So how often would you think it is important for an individual to visit a dentist?
So you would visit the dentist twice a year for your checkups, and if you have any prosthetic work done, such as your crown and bridges or any aesthetic work that is done, you would visit the dentist more often. It depends on you. Everything is very case dependent. So some certain patients will ask for a consultation online and so on. I personally prefer seeing the patients in my chair and then diagnosing them and seeing the best treatment options for them. So 2 visits a year is the general checkup timings.
How important is your oral hygiene? I mean, you get some individuals where they find their gums tend to bleed very often. Is there a specific reason for this?
It's multifactorial. I think it's also, you need to consider the amount of drugs that you're intaking, your health conditions. Those definitely, how would I say, it exacerbates your conditions in your mouth. And I also believe that, well, we were taught that the mouth is a portal to your body. So if you think about it, you're eating, you're drinking, so whatever you're ingesting into your body, it first goes through your mouth. And people don't realize this, and a lot of diseases are first picked up in your mouth, in your oral cavity. So it is very important, and I know, as cliche as this may sound, every dentist is like, did you brush your teeth, did you floss your teeth? But it truly is very important. Yes.
And we also find that more and more kids now compared to then, every other kid you come across is having a set of braces. Why do you think that's so common now compared to what it was back then?
I think it's become sort of a trend, because if you think about it, if you go to school, you'll see kids with braces and they have these funky different colors or elastics on their mouth. And I also think when they speak about the procedure, I think I've noticed that orthodontists have been doing an exceptional job in educating patients and explaining the procedures from a young age to, you know, tell the kids, this is what's happening, this is what you're undergoing, and this is what's going to be the end result. And I think that's causing a ripple effect in schools where those kids are telling their friends about it, and obviously they're telling their parents about it. So I think it was a big aspect of word of mouth. But right now I think social media is so powerful in the way it's utilized. So I think that's also gaining a lot of publicity in orthodontics as well.
Isn't that so different? Back in the day, if we looked at a kid with a set of braces and spectacles, we'd think they're the nerdish type of kid. And yet now we speak of braces as being a trendsetter for teenagers.
Yes.
Also, teeth whitening seems to be very big currently in dental cosmetic. So what is it? What term would you give it? Aesthetics, cosmetics?
It would fall under your aesthetics and your cosmetics. Well, you see there's different types of teeth whitening. It depends on what you want as a patient. So if you want a fast result or a very quick result, you would do it in a dental chair. And it's a little less time that it takes. It's a few hours. And it generally lasts not as long as what you would call a home kit. So basically, a dentist will make a mouth guard for you, and it will insert certain gels into that mouth guard, and you would wear it at night. You would use it over a longer period of time. And I think the results would actually be longer with that mouth guard. So it's case dependent on what you actually want. But there are many whitening kits out there right now.
So would you think an individual that's a smoker or high on caffeine drinks, would the whitening last just as long for them or not?
I wouldn't say that, because it also depends on how much you're cutting down on that intake. Because if you do whiten your teeth, and if you're also going to consistently intake that amount of coffee or tea, it's not going to last that long. You also have to be responsible in your personal habits as well to maintain that whitening process.
So Dr. Bisaal, you've qualified just over a year ago now, is that correct?
Yes, in 2017, the end of 2017.
So you're currently the dentist, I would call you the dentist.
Yes.
And your focus is very much dentistry, oral hygiene, and the basics of dentistry. But what is your vision? Do you one day want to get into the aesthetic and cosmetic side of dentistry? Where do you see yourself in the next 5 years?
That question has always been something that I have trained myself to believe in when I first created my vision board, saying, Rohini, this is what you're going to do in the next 5 years, and so on and so forth. And I've begun to realize that I really now take every day as it comes, and whatever the universe or whatever I've become into contact with, I embrace it. It depends on my feelings. But with regards to dentistry, I just qualified. I am intrigued by all the different specialities. I wouldn't say that I would go into a specific niche. I mean, right now my focus is helping and educating patients or people on the actual dental profession and serving them as a whole. So that's my biggest focus right now. But hopefully, yes, one day I would be able to leave a legacy or my own very own dental practice. But right now, learning more, gaining as much knowledge as I can to do that.
You chatted now about a vision board. Can you tell us a little bit more about how does the vision board come along and how has it worked for you?
Well, my vision board is one of the most integral parts of my life. I would call it something that I use to manifest the life that I currently am living right now. So I created this vision board at the end of my high school career, and in 2013, when I was in my first year of university, I created this vision board. So this vision board is basically images of things or places or people I wanted to meet and things I wanted to achieve in life. And I focused on that every day. I gave it my attention. And I used to play music that music has its certain frequencies that just get you into this whole vibe and gets you into this whole energy system. And I used to focus on that every day and tell myself, you know what, I am going to achieve that. And I feel as if I've proven myself in the last 5 years or 6 years that I can actually take a few of those things on my vision board. So it gives me sort of a direction to achieve certain things in life and meet certain people. So that's my vision board.
So has your vision board surprised you thus far? I know when you put down a vision, you're definitely a very ambitious young entrepreneur, I would call you that, but have you surprised yourself? You know, many of us would put things down and say that I want to do this and I want to do that, or I want to achieve this something in the next 2 years. Not many of us can get to that. So has this surprised you in any way?
Oh, it definitely has.
How many ticks do you have on your vision board?
Wow, quite a few. Haven't even counted it, but I think I had a certain vision that I was going to achieve something in the next, when I put that down, maybe the next 10 years, and I actually achieved it in the beginning of this year, which is half of the time duration that I gave myself. So I feel as if that's given me that motivation and inspiration to tell myself, you know what, Rohini, you actually can do this. And time period, as Albert Einstein said, time is an illusion. So I definitely feel as if I've lived that, and I've created something where I don't only speak about it, but I feel so passionate about it is because I've actually experienced it. And what I want to do is let others experience it as well. So I think that's one of my missions as well, besides dentistry.
So 5 years of hard work, and you finally come to a space where you could say that I've achieved this. And on your vision board, I'm sure you have a few more ticks that you want to tick in the next 5 years. But I just want to bring you back now to being Dr. Rohini Bisaal and talking about dentistry itself. And we've spoken about bleeding gums and how that could sort of give you a message that there's something not really going well with your body and that you could pick up diseases. But what advice can you give our viewers? How can you actually identify that there may be an underlying problem just by bleeding gums or you know, so it's very common. People probably shy from speaking about it, but some individuals actually battle with bad breath. And has that got anything to do with any underlying medical condition?
Well, I would say diabetes is also a very prominent one, because diabetes also contributes to a lot of plaque buildup and also impaired wound healing. So it takes a patient a bit longer for their wounds to heal. So if they do get lacerated, or if they brush too hard especially, it can cause the gums to bleed. And it takes a longer time for that healing to optimally get to a point where, you know, the gums are back to its normal state and so on. So diabetes is definitely one. Hypertension as well. Hypertensive patients, when their blood levels increase, it also causes that bit of bleeding in the gums.
Sure.
Also puberty as well. When your kids hit puberty around the ages of 13 or 12, they get a bit of bleeding, but that's completely normal. And also in pregnancy. So a pregnant woman would also feel that their gums are getting a bit swollen, uncomfortable. So those are the 4 major ones, I would say.
Would you, we hear about people chatting about maybe you haven't been taking enough calcium as you, or not having enough dairy as a kid when you were growing up. Is that a myth? Does that actually affect you as an adult when it comes to your teeth or your oral hygiene or whatever it is? Is it important to supplement with calcium?
Calcium is very important, because if you think about it, there is a chemical reaction that goes on in your mouth where there's that, it's called sodium influx, and with that the calcium influx, and it causes what you call remineralization and demineralization of the teeth. So it's a process where your teeth break down, or I wouldn't say break down, where the plaque build up and so on and so forth. And remineralization basically allows for those calcium ions and so on to remineralize or restructure the tooth to allow it to be at its optimal state. So calcium does play a big role. However, if you are lactose intolerant or you are sensitive to milk or dairy products, there are certain substitutes of vitamins that you can include into your diet. So it's not really something where it's a dairy products is a must. There are different sources that it can be gained from as well.
Okay, so Dr. Bisaal, I wouldn't say Rohini. Dr. Bisaal, tell me, with studying dentistry, did you find it challenging? You know, if everything we do in today's times, everything seems to be a challenge. How was it for you in studying dentistry?
I think there were challenges, but what kept me grounded was I kept keeping myself occupied. I'm the type of person who I don't do well if I'm just doing one thing. I have to keep occupied with doing different things in different niches. So I feel as if I also gave my focus to my exercise regimes and things that would also help me with my mind, body, and spirit holistically. So dentistry was, you get your challenges, but you need to know how to balance that out, especially with your academia. If you feel as if you're studying for too long duration of time, you need to take a break, and you know, I need to have some time for myself as well. So you got to know how to balance. I think that was the biggest thing that I was very grateful to be able to do in my career.
I think it's so nice that we have so many female dentists, because if I remember myself being a kid and a visit to the dentist, I think if my dentist was a female, I would have been less nervous, you know, just having the motherly touch or that sense of feeling comfortable for a child. You just take to a female, I would think, better than a male for those little kids going and doing their routine checkups with the dentist. So I think kids are so fortunate that today we actually have so many female dentists around. But Rohini, with studying dentistry, and you mentioned about being grounded and values, that obviously stems from your family background. So who was your, how could I say, who was your mentor, would you say, and how was the support you got from your family in studying dentistry?
I think my mom is a huge part of my life, where she was literally the pillar of strength when I was studying dentistry. If it wasn't for her, I wouldn't even be in dentistry or be where I am right now. she was a constant motivator where I fell down at certain points and she would be there to completely pick me up again. And I think the fact that she believed in me so much made me believe in myself. So it was kind of like a ripple effect that she caused on me. And I think also she used to cook for me as well and send me food in Cape Town. So that was very comforting as well. So yes, the values, the grounding system that my mom has instilled within me is something that I will carry for a lifetime.
With dentistry growing so rapidly amongst males and females now in South Africa, what does it ever peak? Do you qualify as a dentist and does it stay there, or where does it take you? How far up the ladder can you climb being a dentist?
Dentistry has many beautiful niches. And I think that's what makes the career so beautiful. There's never an end to not learning. There's never an end to education when it comes to dentistry. You've got to constantly update your knowledge on the new things, the new developments in dentistry. So you can specialize in various different niches. It depends on what you as a practitioner have an interest for and a passion for, and that's what you would do well in. So with dentistry right now, as I am a general dentist, so I have the opportunity to specialize in either endodontics, which is your root canals, your cosmetic dentistry, your pediatric dentistry, your orthodontics, and many other specialities.
How long does it take to specialize?
It's approximately generally 4 years. It depends on the speciality that you want to go into. So 4 years would be your general estimate.
So what do you think is the norm? Coming out as a qualified dentist, how long do you think an individual would need to practice as a general dentist before you could specialize?
I think it's case dependent. Getting into a speciality also requires a lot of hard work. You would also need to do your research. You would need to know what you need to require in order to specialize, because it's not something where you just apply and you specialize completely into it. So you need to do your research. You need to know exactly if it is for you, because you also don't want to study something for 4 years and find yourself not liking it. So don't rush into, well, my advice would be don't rush into specializing right now. Gain experience. Know what really is passionate for you as an individual.
Would you like to one day open your own private practice? What is your vision, or what is on your vision board, should I say?
I would love to. Definitely, I would love to. I would love to meet different people, meet different patients, learn from them as well, and be able to treat them in my own special magical way, I would like to call it, because I believe that as a person where you are able to solely and without any expectations from other people and so on, where you're able to express yourself independently and as an individual, you're able to do so much better, because it's not you being working for something specific into it. I don't like being in closed boxes. I like having this holistic approach of life. So God willingly, yes, I would love to open up my own practice one day.
I'm sure you would, with all that magical energy and the positive energy. I'm sure you are going to soon enough open up your own private practice.
Thank you.
Well, Dr. Bisaal, just before we leave, what advice and tips can you share with our viewers just on general oral hygiene? What should we be doing at home if we have bleeding gums, and just the basic? Because so many of us take it for granted. You know, I mean, you're brushing your teeth twice a day and we feel that's enough, but I don't think it's enough. There's a lot more that one can do to better your smile, I would say, at home without having to visit the dentist so frequently, but yes, keeping to the 2 visits per year.
Well, I think also you need to consider your diet. What type of foods you're ingesting. Are you having a bit too rough foods? That also does, affect your enamel. So don't eat hard foods, or, you get those seeds that are hard to bite on. So also be wary on the strength that your enamel can also face as well. Okay. And flossing, I know as much as everyone says you should floss, but you have different types of flosses. You get a wax floss, you get a very thin floss. It depends on the contact of your teeth. Because if you think about it, if you brush your teeth, you're not getting into that contact areas, and what happens, plaque builds up around those areas, and it also has a tendency of going into your gum spaces, which then causes what you would call hardened plaque calculus. And the only way to remove that is to go to a dentist and undergo that procedure of scaling. So definitely be wary of your flossing techniques, your brushing techniques. Also, a lot of people brush too hard and it becomes abrasive to their teeth. So there's a specific way. It's called a 45-degree angle technique, where you use 40. It sounds very technical, I know, but you don't scrub your tooth. It's in circular, gentle motions that you'll brush your teeth. So also be wary of the way that you're brushing your teeth. And if you also have braces, there's certain devices or toothpicks that you would call them that you could use to clean in between those spaces to prevent any white spot lesions from developing on your teeth. So it's also those indications that you were speaking about, like your bleeding gums, and if there's also that enlargement of your gums. Also consider the medications that you're ingesting. If you have any underlying medical conditions, if you're pregnant, or if you're also in that puberty phase as well. So definitely consider all those before you actually get a bit too worried about it. But definitely do visit your dentist twice a year so they can do a holistic approach and a consultation with you.
Well, thank you, Dr. Bisaal. That was so informative. I've even learned to hold my toothbrush at a 45-degree angle. And your story about the vision board, so for our viewers and for myself, something that you've shared with us, empowered me and women out there, males, females. I think you are your own inspiration. And you don't need anyone else to motivate you. If we could just follow Dr. Rohini Bisaal and maybe create our own vision board and start ticking off every little detail in our lives that we were able to accomplish. Thank you once again, Dr.
Thank you so
Bisaal.
much for having me.